Good afternoon. Good afternoon. And thank you all for joining us. I know you're back on again. They're on again. And it's like, yes, this is the State of Black Health here on blackdoctor.org and in partnership with the Rodham Institute at George Washington University. So I want to thank you, partners, and Dr. Gigi for partnering with us on this. And so we said, what is a perfect time? It's the beginning of the new year. So that's when everybody makes those resolutions or those determinations of how they're going to change their life. And typically those life changes involve, I'm going to eat right and I'm going to exercise more. So those are the two of the promises that we make on January 1st. And typically by January 30th, most of us tend to follow it. I'm giving y'all a month. I'm giving you some grace of a month. It typically happens a lot quicker than that. And so one of the things when we were talking about what panels we wanted to have for discussion, we can't have a discussion about health without the two most important components to our health. And that is our nutrition, and that is how we exercise and how we approach, how we move. And so I said, when we're talking about having this panel, there's no people that I know that can handle that conversation better than the panel that we have today. And so these are faces that are familiar to you all, because if you don't remember, Dr. Nina was a host every Friday at noon until she decided to leave us. Of You, Your Body, Your Health. And we had a wonderful, we 30 minutes of just wonderful conversations, and we've talked about diabetes and stress belly and all those wonderful things. And then we also have the dream team known as T-Fal and Chi, and they're on every other Saturday morning at 10 a.m. And they talk about everything from sleep to exercise to EMTS. And we're going to talk about all of those things. And what are your Fab Five? And we're going to talk about those 5 things. What are those 5 things that you should know about your personal health? So I'm going to shut up. They didn't sign on to hear me talk. So thank you all. Welcome. Thank you for joining us.
Thank you.
Yes, thank you for having us.
And hopefully we can get Dr. Yolanda back. I think she's trying to connect. She may have some poor connection, so we'll get her on as well. She's a both double board certified pediatrician and bariatrician, which is a fancy way of saying she deals with obesity. And that's one of the things we're going to talk about. So I'm going to throw this question to T-Fal and Chi. And Nina, you can jump in too. Mm-hmm. Obesity, we hear that term a lot, right? And I think right now people are using it more as a description versus a diagnosis. So can you speak to that? What is obesity and how does it impact our overall health?
Okay, so thank you so much for having us, Ellis. And I just brief intros. I'm an infectious disease physician, a professor of medicine, and author, podcaster, and a wellness coach, and the other half of T-Fal and Chi, joined by my husband Chi here.
Yes, thank you so much, Alice. And I'm a health and wellness expert with a focus on nutrition, exercise, and mental health. So thank you for having us, and we're excited about the opportunity to speak to the audience today.
Thank you so much. And so your question around obesity and the misconception and how sometimes people use it as a term, but we do know that it is a diagnosis, just like we say people living with hypertension or diabetes, living with obesity. Now, so what we know about that is that it is a medical condition, and the ways in which it is defined has to do with calculating like your weight and your height and getting your body mass index. And what we do know is that obesity is associated with a myriad of health outcomes, right? So obesity increases because it's a state of chronic inflammation, right? The extra fat cells they're metabolically active, and there's inflammation. And with that, there's a clustering of conditions like high blood pressure, diabetes, high cholesterol, heart disease, stroke, higher in people who have the diagnosis of obesity than people with a normal body mass index. In addition to that, there are physical consequences in terms of joint, musculoskeletal issues. So it's a medical diagnosis. I know you have an obesity expert coming on, but it is based on your weight and height. There are things we can talk about the limitations of BMI, why it's important to look at your waist circumference and look at a whole bunch of other things. But that is just a quick answer around obesity as a medical diagnosis and the clustering and why it's important to really talk about obesity and what it means.
Dr. Nina.
Hey, there's not much more to say over there, but do I have an obesity question or am I responding to something else?
Well, I was just seeing if you had anything to add to.
No, I
Yeah.
mean, that was a very nice rounded example or rounded explanation of obesity as a condition. My background, for those who haven't seen me here, is in kinesiology, nutrition, and rehabilitation. And I'm also a healthy living coach. So I have an academic background where I've actually studied lifestyle interventions in obesity and related conditions, including heart disease, diabetes. So I've been on the research side at both the small microvascular level and the macrovascular level, big vessels, and also the whole person. And it's such a multifaceted condition that goes past numbers that, we have the numbers in order to be clinical markers. But as a healthy living coach and in everything I do as a translational scientist, is really study the impact, the multifaceted impact of different things that we face every day on the condition that is obesity. So we're talking about diet and nutrition, the obvious ones, right? Lack of physical activity being an obvious one, but also the impact of stress, which actually plays a much bigger role than we give it credit for. Stress actually plays a role in all of the aspects that contribute to obesity as a whole, including alcohol abuse. You're talking about diet. You're talking about even exercise behavior. So I really look at the condition that is obesity from more of a holistic standpoint. And in coaching and everything I do, also as that salad lady, which is really focused on whole food nutrition for whole life wellness, is try to counter all of the aspects of obesity that influence obesity in order to really hone in on the problem. And really weight loss, which is what's considered the better outcome of obesity, becomes like a side effect of everything else you do.
Absolutely. So, Tifa, one of the things you mentioned, and when you're talking about obesity, was waist circumference, BMI, and I know you all are wearing your shirts that says, you got your 5, and so you said there are 5 things that people should know about their personal health. What are those things? I think there's some numbers associated with that. What are those 5 things that everybody should know about their health in order to improve their overall health and wellness?
Of course, and that's why this is our brand. How fab is your 5, right? So whenever you see this is what we feel, and we know by the CDC that is responsible for over 30% of spend. When you're looking at spend in terms of chronic diseases, over 85% of people who are suffering from chronic diseases, just lifestyle related. So we decided that these 5, which we show here, which you have blood pressure, your BMI, your blood glucose, your waist circumference, and also your cholesterol. Those are the impact in terms of when it comes to what impacts your body most. If you're able to keep a good measure on these 5, you're more likely to spend less, feel better, and be your very best self. So that's why we're honing on this 5, because we know that's where a lot of us fail in terms of connecting what we eat, the exercise that we add, and also mental health. All this together comes to make us our best self. So we like to focus on this. Do you want to add anything?
No, absolutely. And I'm really just saying that, ignorance is not bliss. Like knowing those numbers. And, sometimes we focus so much on weight and people think, well, I'm a normal body weight. I'm actually skinny. To say that this has nothing to do with that. Like knowing those numbers is critical, just like normalizing knowing those numbers. We talk about you can't improve your credit score until you know what it is. Knowing those numbers is very critical to know where they need to be, where you are, and how you move along that wellness continuum. And we chose them also because these are things that no matter whatever healthcare setting you go to urgent care, you go to ER, go to pediatrician, they're always checking your blood pressure. And many of us don't even ask what it is. We're like, well, they didn't say anything, it must be fine. It's also something you can measure at home. So whether or not you have high blood pressure, that you can check it yourself, you can check your blood glucose, you can get out a tape measure. So we looked at things that impact our communities a lot, things that are easily measurable, and things that have numbers that you can work towards, and things that you can improve on. So it's just one of the few reasons that we chose this 5, because it's really, these conditions are impacting our communities.
And just to add real quickly to that as well, because we talk about obesity, there's so many reasons why we need to make sure that we're doing the right understanding obesity and the impact on our bodies. We look at back pain alone. It's an $80 billion industry annually, but we are not connecting that the weight we carry on our bodies impacts our knees, impacts our spinal column, and all of a sudden you have all these comorbid conditions, heart disease. We're changing our knees out. We're having our spinal columns, infused with, parts in that. But we have to understand the impact of every ounce or every pound of weight we carry is 4 pounds of pressure on our joints. If we begin to make that connection, we'll understand that we need to eat better, move better, and do the things that will lessen the amount of weight we carry around.
Right. Those connections, go ahead. Those connections are critical because a lot of times we don't think about it. People talk about this person had a stroke or this person had kidney failure. We talk about that a lot. This person just went into kidney failure without connecting diabetes and high blood pressure to it. So being able to say that these, touch of cholesterol is what was a stroke, early dementia, those things, just having connections and having people make those connections. Yes,
absolutely. Dr. Nina, one of the things, and you know me, you know me for a while. I like to get real with it. This all sounds great, right? It sounds great. Eat better, exercise more. We hear all of those catchphrases, especially around the beginning of the year. We hear all those catchphrases from our doctors. How does that play out in real life? And both of you all are coaches. So I'm saying this question. I'm asking a question to both of you all. When you're working with real people, and talking about they've got stressors, they've got 2 kids, they have the job, they got the dog, they got the husband, they may have some marital strife, they may have some financial difficulties, and now we got COVID, which is the elephant in the room now, which is sucking up all the oxygen out of the room when it comes to healthcare. How do you get that person to make a lifestyle change when they've been eating Twinkies and Snicker bars for 20, 25 years, and now you're trying to get them to eat a salad?
You would say a salad, wouldn't you?
Right.
Well, you know what? The interesting thing is, one of the things we do as that salad lady is we focus on very small goals. Oftentimes, and this is just to be clear, when you come at someone and you're saying, you give these numbers are great, but if it's something that they can't really kind of pinpoint and see a success with right away, you're going to lose them. So we really focus on these small goals going into these larger goals, which ultimately will influence, their health as a whole. So one of the things we do at that salad lady is just focus on easy ways to incorporate whole food nutrition. While you may not be able to totally commit to exercising, 5 days a week or whatever, you can commit to eating a few servings of vegetables or replacing, something you normally eat, one of those Twinkies maybe, for a snack that's more wholesome. And it's something that involves really making it approachable. So as a healthy living coach, I'm all about approachability. I'm all about making healthy living also accessible. As someone who grew up in the Inglewood community on Chicago South Side, I lived in a food desert personally. But one of the things I benefited from having a lifestyle change, having been an obese adolescent myself, was that just the small idea of giving me something that was easy to absorb. I'll give you a quick example. My mother was diagnosed with diabetes. And one of the things they did, this is before the internet and everything, is they gave her these little, it was almost equivalent to like a point system, but they basically said, here are the foods that that are friendly to diabetes. And, here are some of the things you want to pay attention to. I was 12 years old and it was very easy to kind of approach. Okay, so I have these foods that I can eat. And if I eat these foods and not maybe, eat these 3 foods instead of these 3 foods, maybe something can change. Something changed really quick. I started losing weight. Now we go into the exercise. I don't have anything. I live in a food desert. Well, can you walk around the block? Well, yeah, I think I could do that. Well, can you do that 2 times a day? Oh, yeah, that's doable. These are things that are doable. And one of the ultimate outcomes, to Folly, and she said something, and that was very powerful. It was that the more you know. A lot of the times people just don't know. They don't know that a walk after dinner can actually help the way you metabolize glucose. People don't know that, sitting down and watching TV after dinner versus going for a 10-minute walk can actually make a huge difference in your health. So really, it's all about educating and what to follow. And you're doing and what I'm doing, it's ways to educate people on how these very, very small things they do can make a whole lot of difference. And then those numbers, well, those are consequences. They change as a result of continuing to make these changes. And another big one, and I emphasize it in the show, small changes lead to very big gains, but it has to be stuff that is doable. It has to be stuff that they watch the show, they walk away and they say, you know what? I can eat 3 servings of vegetables a day. I can drink an extra cup of water versus having a soda. I can do this. And that's really what it's all about. And the wellness industry doesn't do that right now. The wellness industry says, get on this ketogenic diet and do all of these different exercise programs. And then only if you do this strictly will you lose weight. We need to focus on small things that are actually doable for people. And that can happen no matter where you live, how many kids you have, and even, it really, to a certain extent, it doesn't matter if you're trying to lose weight or not. These are changes that can influence all those numbers that Tafali and she talked about, aside from just losing weight.
Yes, and go ahead.
No, I'm just going to say, in terms of, you mentioned a couple of things, Alice. You talked about COVID being here. So we're living in a very sedentary, world today. So everyone's in front of a tube in the computer and no one's moving much, right? So, but like Nina talked about, a lot of people live in food deserts today. Yes. But even when you live in food deserts, you have to understand, trying to make those connections that junk food does your body no good, period. Sodas, junk food, processed foods, over 70% of foods you find in stores have added sugars. Being able to understand all of that and being able to add exercise, good nutrition, being able to understand that, a package of oatmeal, which is already packaged with sugar, is junk food versus oatmeal that you cook for 2-3 minutes. Being able to make those connections is super important, and how it impacts your body and how it makes you feel, move, and think.
And I think that's the critical part. And I think both Dr. Nina and Ichi, you mentioned that too, that our reason and our purpose around our wellness has to be from within. It can't be because of what you look like on the outside or what you're trying to do for vacation. If somebody gave us a quick fix for your finances, you would think this isn't going to last. Why do 90% of diets don't work? Because it's weigh this, count this, buy this, only drink this, shake this, and you can't really influence a family if the one person is on this plan where they're weighing stuff and they buy this particular nutrient. The minute that's done, that is done. So a lifestyle that is sustainable, small changes where you can actually, when you're talking to your family about it, you're saying, we're going to do this because as a family, guess what? If you say, no more this because I saw it on a show, everyone's going to be like, Mom, you do this every 5 minutes. We're not doing this. But no one's going to fight. Like, if we start to do this, drink more water as a family, substitute 2 veggie servings. You only have one body. If you drink more water and you have more veggies, there's only so much space, that kind of stuff. Challenge yourself to dance offs between Netflix. Before you go to the next episode, before it goes to the next one, you have to get up and everybody do something for 2 minutes. We do that. So things like that actually bring multi-generations together. You choose your music, dance, whatever it takes, but they're measurable and you can actually be a lifestyle. So it's not like you're doing your stuff. Have the children be involved in the chopping and dicing. Let them see what a real apple looks like and a real pepper. They don't know. And actually make it fun, right? Lifestyle, and makes that it's sustainable. Something needs to be a little bit longer than a day before it becomes a habit, right? Yeah. So why don't you say, we've done this a certain way forever. Let's give ourselves a couple of weeks as me or as a family, and let's see what happens. What do we have to lose? Yeah.
And it's generational health, right?
It is generational health.
So
I'm glad Dr. Yolanda is here, pediatrician.
Whoever makes the decision at home to buy groceries has the key to the family's health. It's as simple as that. If you're making that decision, you're buying groceries, you're not buying cookies and putting it on the table. You're buying bananas, you're buying fruits, you're buying, oranges and all that. You begin to change the culture. One family at a time. And we're not, and again, at Tifal and Chi, we don't focus on losing weight. We don't. Because we know that when you do all this together, if you're exercising, you're eating right, your mental health is in a good place, you're sleeping well, weight comes off.
That's a byproduct. I mean, nobody's going to say, as a family, we're going to sleep better. You're going to feel better. Mom is going to be able to run after you on the bike. We're going to be able to save money for other things because we're not spending at the doctor. We're going to have more energy. We're going to have more mental clarity. Let's do this. I think that sounds a little better. That we're not eating this because we all need to lose 5 pounds. It's not. Again, it's all about how you feel and just knowing that you're your own biggest competition, that every day you're moving towards a better, healthier version of you, nobody else, not anybody else, you. So
Dr. Yolanda, thank you for being able. I know there's some technical difficulties, but we're so happy to have you here. So I've already kind of done your introduction and talked about how you're double board certified pediatrician and bariatrician. And one of the things we've been talking about is, right, how do we create that healthy lifestyle? And Chief Allen Chief mentioned it when they were talking about you could have multi-generational, right? And
I will say, can you all hear me?
Yes, we got you. And so how do you...
this has been a day of technology for me. Let me see something. Oh, my goodness.
Can you hear us?
I have no idea. I can no longer hear you all.
Okay. All right. So we're gonna. We've got other folks here. We've got other folks here that can handle that. So what my point is, and they're talking about multi-generational because we talk about we're talking to Black people, right? And we're talking about the state of the Black family, and we know that Dr. Nina alluded to it in terms of food deserts. You could have multi-generational people living in the same household. So you got grandma, mom, it could be uncle, brother, all these folks all the way down to children. How do we develop a plan? And y'all did a great job of kind of detailing it. So Dr. Nina, if you could build on that, how do we develop a plan that can meet the needs of multi-generational folks? Because grandma has different nutritional needs and different issues, health issues than the little nut, that's 7, right? Little man, that's 7. Okay, so how do we build a plan that can satisfy multi-generations?
Well, I'm going to focus in this case on nutrition because I would dare say that seems to be the one that is, in my opinion, not the most approachable. And I also call nutrition kind of like it's like a keystone behavior, meaning usually when you're eating things right, sometimes everything else just falls into place. So when it comes to nutrition, I generally recommend, and this is a big one because I've worked with children, I've worked with families, eliminate the rules. So the rules are the problem. The rules are the things that tell us, it's kind of what, like Tafali and Chi were saying, the rules are saying, you have to eat this much of this to do this. If you do this, you shall lose 5 pounds, or, that sort of thing. But one of the first parts, and I talk about this a lot with that Salad Lady brand. The first thing is really focusing on prepping ingredients. And what that really means is it starts with really focusing on color and focusing on ingredients themselves versus food. And I'm going to tell you why. It's very approachable. We know the colors of the rainbow, right? It just so happens that the foods that are good for us match many of the colors of the rainbow. So instead of focusing on what we can't eat and what we should eat, we just focus on the rainbow. And that's something that applies to every single person of the family, no matter if you are following a ketogenic diet or because you want to. Because I have to also say that oftentimes we talk about diets as if diets are the foods we eat. They don't necessarily have to be bad. We get dietary interventions kind of mixed up with diet sometimes, but diet is what you eat. So some people do follow ketogenic diets for health related reasons. I have a relative who has epilepsy. So the ketogenic diet is actually good for her and it works for her. At the same time, I personally follow an intermittent fasting regimen, which many people would say that that's, a fad diet, but it really isn't. It's a lifestyle. It's the way you eat. So really focusing on and respecting people's different eating behaviors based on why they eat. Same thing with the low carb diet, which is effective for many people with diabetes. Really doing away with all of that and just focusing on the fact that no matter where you are in your diet and nutrition journey, that counting colors is a very effective first step that can start with just prepping that way. So here's what I do in my household. And it actually, I would say that most households probably echo my household in general. You have picky eaters, you have people who won't eat anything. You have, they can be kids, they could be adults. You have individuals who may not have health problems on paper, who don't gain weight and things like that. And then you have people like me. I love food a lot, and I gain weight. And so really in my house, we focus on counting colors. And with that counting colors, we focus on prepping ingredients as such. So if you have Big Mama with her health condition and you have the finicky eater in the house, instead of going around saying, we're going to all eat this same big meal and do this same thing, let's do something like prep peppers, red peppers, orange peppers, yellow peppers, green peppers, colors. Let's do something like chop up some cabbage and have it sitting there. And then let's do something cool like put some nut butters or avocado, healthy fats, maybe like 5 or 6 different ones, and see what people like. And really say, you know what, every day we're going to try 3 of these things, or 1 of these things. And then the next day, we're going to try another one of these things. And it really goes with having the whole house, not just the person who grocery shops, because in my house, it's mandated that people come to the grocery store with me. So really, because it's really the only way. If you're involved in that process, you're going to want to see it through. And this applies with children. I'm sure Dr. Yolanda, if she gets back on, would agree. When you have kids help you with the meal prepping process, when you actually teach them, this comes with educating, which also comes with educating yourself. Far too often we focus on people to tell us what we need to do, especially physicians. I hate to say, but doctor, tell me what I need to do. We need to focus on educating and empowering ourselves so we can do that with our children. So if I take my child and I say, you're going to come to the grocery store with me and you're going to pick 3 colors of food and we're going to try them. You pick it out. And you let that child pick it out. Now, I know we have busy jobs. We have a busy life. The last thing we want to do is be that salad lady and start picking out different vegetables and foods. But if we really want to change, the same way we're adamant about making those hair appointments and those appointments for those haircuts and those appointments for those manicures and pedicures, this is how we have to look at the way we eat, because those things are not going to keep you alive. They'll keep you looking good, but they're not going to keep you alive. So really, when it comes to the Black family, sometimes I have to give people a little tough love and say, it starts with that one step. Count your colors and everything else falls into place. Seriously, the meal prep falls into place. The skin falls into place, the hair falls into place, those numbers that Tafali and she talk about, they fall into place, because what you're going to do is fill yourself up, your body up with so much goodness that it won't have space for the bad stuff. And notice I never told you what you couldn't eat. I told you what you can eat. Because telling adults what they can't do is a sure recipe for having them do it.
So, well, I think we got Dr. Yolanda. We got you here. So one of the things, we've been talking about, and we're talking about eating right. We're talking about eating the rainbow and eating healthy and switching from oatmeal packets to cooked oatmeal and all these different things. And one of the pushback that we get, I'm going to be speaking for the lay people, is that it's expensive to eat healthy. Right? That's one of the top pushbacks we get. Oh, I can't afford to eat healthy. You got to buy all the other stuff. But I said, well, if you bought a water filtration system and stop buying all those sodas and sugary juices and you cut that out, you're going to save some money. And then that money that you save could be going to other things. But I'm digressing. How do we get people to recognize that it is more of a mindset change and get over that basically excuse? I'm not going to call it a barrier, but that excuse of it's expensive to eat healthy.
Well, I'm gonna jump in for a couple minutes in case I like fall off again. So anyway, thank you guys for bearing with me. Sometimes the hazards of living in the community that you serve. I am in Southeast DC. and my internet does not always work the way I need it to work. So I'm just gonna go ahead and leave it there. So, but I heard a lot of great things that you all were talking about in ways to offer options and things to do with children. And you're talking about doing this on a budget. So first of all, there's so many ways that we can get connected. I'm a physician, I'm a pediatrician, but I'll also do weight loss, and I've like done grocery store tours, right? I've gone to the grocery store with my families and I've walked them around and really talked about, first of all, the outer rim of the grocery store is really where we need to be, right? That's like, if we're taking it back to traditionally what's really healthy for us, if we're living like we live off the land, people talk about paleo, people want to talk about, keto, eating clean. A lot of those things can be done when you're eating whole fruits and vegetables, more plant-based. And even if you're going to eat meat, which is fine, you want to eat leaner, healthier options. But again, it's around the perimeter of the grocery store. And truth is, those things are actually a lot cheaper than we think they are, right? So you can feed a whole family on a whole chicken that may cost $7. You're paying you think one for what is it, 10 for 10 or whatever those meals are a bargain, but you're not just getting the protein that you're buying. You're getting, it's laden with fat, it's laden with sugar, it's breaded. It's going to cause nausea, gas, upset, and honestly, and weight gain. And you're not just talking about the money that you're spending on the food. Now we're talking about the cost of being unhealthy, right? We're talking about,
and let's not forget the 10 for 10 doesn't come with sides. So by the time you get the sides,
well, exactly. And people are okay. They're accustomed with spending $20 to $30 at the end of it, right? Because they get what they think they're getting so much, but you're getting more than you bargained for. You're getting the salt, you're getting the sugar, you're getting the fat, you're getting the processing, which actually causes its own issues with creating this cycle of wanting more food later when you're not hungry. You're not learning how to eat to be satisfied and full. Eating to be satisfied and not full. That's actually the comment I'm trying to make. So there's so many things that we can actually talk about. And when you talk about this, really just explain that there's macroeconomics and there's microeconomics, right? You're talking about looking at it as dollar for dollar, but we're talking about the big picture. The cost of heart disease, the cost of diabetes, the cost of obesity is in the billions when it comes to our healthcare costs. And we just don't put enough money into prevention and into knowledge and understanding. And I'm so proud to have my colleagues here talking about how to get our kids involved, because it really does start from the top. If our mindsets don't change from the parent, our children will never learn. So we have to model that behavior. My children understand that when I walk into the door, I'm going to get them involved into the cooking process.
Correct.
So I think what happened was I was trying to get on. See, this is technology again. I was trying to get on to my other computer, and then it popped on. So now I'm on too. There we go. So I'm gonna cut everything out. Yeah.
So it's just while we're just
so G, I wanted to ask you all, because we're talking about a lot about diet and nutrition, which as we talked about on your last show, 75% of health is your nutrition. But let's talk about that other 25%. Let's talk about exercise. Because a lot of times people say, I don't have a gym. We talk about food deserts, but what about gym deserts? What are those things? Oh, what can people do? I don't have a machine. I don't have weights. I don't have this. I don't have that. All these myriad of excuses that come out of people's mouths as to why they can't exercise. Can you help people just on that first step of what they could be doing, just that little bit of movement that can go a long way in terms of their total health and wellness?
Go ahead.
So thank you, Alice, for that question. So when it comes to exercise, right, we talk about the 25% versus the 75%. So exercise can be anything. Exercise does not have to be expensive. You don't have to have a gym membership. You can simply take a walk in your neighborhood. You can do yoga. You can meditate. You can dance like no one's looking. anything that allows your heart to be elevated, to just bring up your heart sound, is you need to do that. There are two ways you actually, when it comes back to losing weight, there are two ways. Through exhaling fat cells through your mouth, when you blow out, fat cells escape, and also through perspiration through your skin. So you have to bring your heart up to where you're actually exhaling and sweating, which means you're drinking a lot of water as well. So exercise does not have to be expensive. We need to figure out, especially in this COVID world today, even when you're in front of a chair or your computer working all day, get up and sit. Get up and sit. There are different ways. There's vitamin walking, vitamin jumping, vitamin dancing. Your body needs different forms of movement to be its very best self. That's why you have vitamin A, vitamin K, vitamin E, because it does different things in your body. Mm-hmm. When you move your body in different ways, it impacts different parts of your cell and your cellular structure.
Yeah. So, and just, a lot of times you hear the excuse, for us women, my hair, my this, and somebody, I think, like, do you want to look good or do you want to feel good, short term, long term, right? Whatever, if you need to do a protective style, you need to wear it with whatever it is, because and when you exercise, it's for you. It's nobody cares what you look like. Go there, sweat, and again, small steps. So if you've never done anything, and that's why people get intimidated, like now it's this to that. No. Start walking. Walking and using technology. Track yourself, challenge yourself, be your own competition, get accountability people be on board. Dance, do different. Somebody chooses the soundtrack. That's 3 minutes there, that's 4 minutes, that's in 10 minutes, get your heart rate up. And every day kind of build on that. And just making it fun. A lot of times we feel like I need to go exercise. I don't have time. When is the best time? When you do it, right? When you do it. Sitting is the new smoking. Sitting is the new everything. Sitting is killing us. Yep. Sitting is killing us. And just doing that, getting up between at your calls every hour, get up and do something, doing something, being consistent about it, making it fun. For sometimes you just need to wear something that makes it fun. So you have to psych yourself up sometimes. You wear something colorful, just whatever it takes to just get yourself going, staying active, and not forgetting those NEAT, right? Those non-exercise activities during the day. Because a lot of us think we can do all this stuff, then we have 30 minutes, drive to the gym, park closest, do 30 minutes, pick something on the drive-through, and we're done. Nothing happened. It's all these other things we're doing during the day. Climbing the stairs, if you have stairs, going outside quickly, doing laundry, gardening, doing out there with the kids. All of these things add up, right? They don't count as like going to the gym, but that's still your body exerting itself. Yeah, and so that's exercise.
I was also going to add, we don't believe there should be any excuse when it comes to exercise. 5 kids, 1 kid, dog, it doesn't matter. Because we always make time to watch shows on TV or do other things. Even when you're watching those shows, you can do something, right? What is your why? Do you want to live long and a healthy life? Or do you want to live a very unhealthy life as you grow older? So when you understand your why and you want to get someplace with your spouse or your children or your loved ones, then you're going to make time, even if it's 5, 10 minutes, 15 minutes during the day, that you can take away from maybe watching that show you love so much. How about exercising while you watch it as well? So we believe that you can still make time, regardless of your family structure, to put your why in place so you can live a long, healthy, not just a long life, but a long and healthy life.
And get them involved. And with modifications, there are people who have disabilities or need modifications. You want to make sure it's done safely. You want to consult with your physician, make sure that there are no issues. Why not? But even within those limitations, figuring out what you can do safely, how you can do it safely, and doing it sometimes as a family sometimes gets people more involved.
I want to add some things for this pandemic. People have been taxed, right? And there are several people that we have to give ourselves some grace. I do want to be very honest about that, because I'm big on giving people as much information, giving instructions, but I also know that some people have been overwhelmed. And I don't want us to also ignore the fact that there are some things you can do that just relieves stress, right? So relieving stress is almost as important as exercising. I want people to really understanding that, okay? So for instance, I'm very much into transcendental meditation. And Studies show that transcendental meditations lowers cortisol. Cortisol is a stress hormone. That stress hormone is actually something that adds to weight gain, anxiety, depression. And so I don't want to only give the message that we need to add things to your day. I don't, and I'm very much in sync with my brother and my sister. I want people to understand that exercise is not just you going to the gym. It is choosing the stairs over the elevator. It's parking further away. It's getting up and getting a walk outside. But I also don't want to come away with the message that you need to keep adding to your day, because one of the things that I will recognize is that we're in a state of feeling like, what more can I add? There's so much happening. We're in a pandemic. People are afraid to go out. People are afraid to do these things. And so I need them to just reconsider how you're using your day. Redesign how you're using your day. Like Dr. Franklin said, you need to put your schedule, the same schedule you put together for that hair appointment and those nail appointments. Put a schedule together for how you're prepping your day, how you're prepping your food, how you're getting rest, relaxation. I want you to use your sitting down moments, not to just be sedentary, but to maybe meditate for 20 minutes in a day, right? I meditate 20 minutes twice a day. I also have the opportunity to exercise, but on a day where I'm going to choose one or the over the other, I may get one meditation in so that I can get some exercise in. Or if I don't get any at all in terms of exercise, I'm going to make sure I meditate. I just don't want the message to only be that we have to continue to add to our lives.
Please, let me add to that. Thank you. So Dr. Yolanda I sat here and I could not have said any of it better. And I'm going to give you a scenario of Nina prior to my PhD, who was training. Nina was hardcore. Nina was saying, do this, do, eat, do this. But then life hit me. Age hit me. And as she said, oh gosh, COVID hit. And I went personally from being a marathon runner who had a very easy way of going to having an infant son and arthritis. That changed the game, even for someone like me. And you brought up cortisol, because I actually, before you got on the show, I brought that up. The role of stress being an even greater role, because what we don't understand is that obesity is stress. Obesity is a stressor on the body. All of these things are stressors. And you can eat kale, you can have the perfect exercise routine. And if you have stressors in your life and you're doing little to manage them, that will kill you. This is coming from a father who was 6'7", who had someone with a father who was 6'7", had every positive exercise behavior you could possibly imagine, ate everything I told him to say, eat, or everything good that you would think should be done from a behavioral standpoint, but stress took him out. Stress took him out in the form of a hemorrhagic stroke. So I've seen that stress work. And I've seen that stress work in my own family right now. So I want to sit and emphasize that stress in this moment, as Dr. Yolanda said, that stress is bigger than any exercise behavior you could possibly imagine. And I'm going to tell you this as well. You talked about meditation. I actually did this personally because I was going through my own little stressful situations that drove my blood pressure up a bit, not to the form of diagnosis, but it was after my arthritis and the notion of possibly never running again. Well, I had to sit down and breathe, because when you have all that stuff constantly coming in at you, sometimes you sit down and you take time to breathe. Now, if you wear a wearable of any sort that measures or encourages you to breathe, if you want to see a small change lead to an outcome very quickly, breathe for a minute and watch what happens to your heart rate. Breathe for 1 minute, 60 seconds, and watch what happens to your blood pressure. Now, think about if you do that, as Dr. Yolanda said, for 5 minutes and 10 minutes. That's a cumulative effect. on that cortisol. But even when we exercise too much and we're stressed, that increases cortisol. I'm an exercise physiologist also, and that increases cortisol level. So a lot of us say we exercise for stress relief, and we're actually stressing out our bodies doing it. Why? Because we're not handling that underlying stress that's going on from other things in our lives. And I have done it all personally. I've seen clients do it all from the standpoint of using exercise and diet to relieve stress, and that alone just doesn't work in this climate. So that's why I also emphasize small changes. Again, as Stefali and Chief said, instead of focusing on going to the gym or trying to do X, Y, and Z, focus on just the little stuff you can do. You can get up and walk around for 5 minutes every hour of the day. And it doesn't have to be a push-up or a sit-up. It can be as simple as getting up out of your chair and just walking around. And that'll make you feel good. And if you think about doing that every waking hour, that is 5 minutes you're accumulating. You're going to get in at least, at the very least, 80 hours, 90 hours of just activity, I'm sorry, I said hours, just moving, or minutes, just moving and doing, effortlessly moving without even having an exercise session. And that's also going to influence your cortisol and all those other stress hormones that can lead to weight gain and other health problems. So thank you, Dr. Yolanda, for bringing that up. I could not agree with you more.
I want to ask one thing, and I'm not sure how much was talked about during nutrition.
Yeah.
But in terms of being purposeful and intentional with nutrition, there are also herbs and spices and things we want to make sure people understand. You know, we don't learn this stuff in school. None of us learn this in medical school and in graduate school.
I did a little bit.
We have to go, well, yeah, I mean, but we have to do a specialty, right? You have to do nutrition. You have to, and one of the reasons I say this as a physician, because this explains why there's plenty of out of shape, overweight, obese doctors and nurses. This isn't
smoking during the breaks, smoking during lunch breaks.
This isn't what we learn. But there are things like cinnamon, turmeric, anti-inflammatory,
cayenne pepper. Cayenne pepper. Everyone has
that. Reduces your suppresses appetite and increases your metabolism. I mean, I found that out. I put cayenne pepper on everything. Ginger. But there are things that we can actually learn.
Garlic.
Garlic is good for heart health. Yeah. People don't know that there are things that we can actually intentionally spice our foods with that don't just taste good. They have medicinal values. Yeah. So one of the reasons it's so important to invite our children into the kitchen, right? And invite our spouses into the kitchen is because these are things that we have to teach that actually are going to teach longevity. They're not just, my girls know how to cook. My son knows how to cook. If something happened to me tomorrow, we would have, a great life. I don't understand how people, and I know it seems out of love when you take on that role and you do it for everyone, but I think we're handicapping our children. We're handicapping our when we count on others to feed us. So we count on others.
Let me jump in here because we've just got a little bit of time left in this panel. So I'm going to kind of wrap up. Everybody kind of give. We're going to go around the horn and give. Yes, I know. I see you, T. Fellas. So we're going to come to you all first, and I'm going to put on screen while you're talking. I'm going to scroll along the bottom of the screen how people can get in contact with you. So Nina, I have you at that salad lady, and then Dr. Yolanda, let people know how they can get in contact with you. So if you want to know more about T. Fallon Chi, follow them on social media. That's at T. Fallon Chi. It's scrolling across the bottom of the screen. And the website's the same. So you don't have to change anything. The website's www.tfallonchi.com. Go there, get all the health and wellness information you need. Go ahead.
I agree. So thank you so much for having us. So, we talk about these numbers because as a physician in the hospital, people are aware of these numbers. But the way we work with our wellness coaching is to be meeting people where they are. So when we talk about generational health, and grocery shopping, if you're still learning the perimeters and doing all that stuff, for some of our clients, they need to do 2 or 3 times so they get it right before they bring the kids along. A lot of our clients, we tell them, bring the kids along, have them be part of the chopping, the dicing, so they see what's going on. doing exercise and movement together. When we talked about meditation, because we know that wellness is not something that's necessarily taught, right? In med school, we're more about disease management. And wellness is not just absence of disease. So we talk about physical health, mental health. We know the importance of sleep. We didn't even get to talk about that. How your gut health impacts your productivity, your mental clarity, how you sleep. How you sleep affects your cortisol level. So all of these things are things we break down. These numbers are important about the message, so people actually check those numbers, but they're never how we start, because how we start is making sure that what you put into the body as your fuel is fueling your gut bacteria, it's fueling your energy, your mental health. Meditation, absolutely important for bringing things down, and just really making small, measurable changes that you can do and you can impact the people around you. And it starts with you, because this generation of kids is projected to have a shorter lifespan than their parents if things continue. I work in the clinic, I've seen kids with fatty liver already, which means they already have a higher risk of diabetes. So a lot of it has to do with how we move our body, what we put into it, how we sleep, how we manage stress, and all of these things are things we teach with our clients. Stress management.
And just to add, we don't believe in terms of adding to people's schedules and all that. What we truly believe is that if you can put all this together, there are times that we honestly have doing other things. We can actually take from those times and not add onto your schedule. We don't believe in add, because we know life happens. We know that very well. So we meet you where you are. We do an assessment. We work with people all over the world, in Australia, in Africa, and all that. We have our coaching clients in different parts of the world. So we meet them where they are and begin to look at who they are as a person, who their family is, their structure, and begin to build a plan for them that works for them. And not for anybody else. And so this is what we do as TFLMT, and we encourage, you know where to find us. And as you know, we designed our merch. What we wear is what we designed as a couple. And we use that to try to teach and educate people around the world about the benefits of being your very best self and not like anyone else.
Yeah, and drink more water.
And drink more water. And I love it. They've got a segment on their show called Make It Make Sense. And so they take these complicated issues and they break it down to make it make sense for lay people like myself. And so I put the website in the comment section so you can click there, and also where you can find TFLMT. Thank you. Dr. Nina.
Hi. So thank you so much for the invite. I enjoyed myself here on this conversation. So I will sum it up by saying one of the reasons I founded That Salad Lady, which is my blog and my brand, is to boost people's eating confidence, and not just their eating confidence, their confidence when it comes to approaching healthy living in general. We use approachable salad creations in order to encourage people to learn more about the foods they eat, to be more mindful with the foods they eat, but also to have fun with the foods they eat. One of the things we emphasize is this is your life. This is not even your kid's life. I mean, honestly, you can role model, you can do that sort of thing, but really focus on what you need to do to improve yourself, because you cannot help others if you don't help yourself first. You can't teach others if you don't learn these things first. So that's one of the things that we emphasize at That Salad Lady. But moreover, it's whole food nutrition for whole life wellness. Every single bowl or plate of food is an opportunity to build whole food nutrition. Every bowl or plate of food is an opportunity to build whole life wellness. And we don't just look at building your bowl full of wellness as what you put in your food or what you put in your salad bowl, but we also view it as what you do for your body in general. Your body represents a salad bowl. Your wellness represents a salad bowl. And we're all about improving the way you build your bowl. So definitely visit thatsaladlady.com and you'll see exactly what I mean.
Absolutely. And she has a wonderful concept when she was doing a show, and it was called, she wanted to increase your health span, which is the number of healthy years that you have in your life. So you have your lifespan, that's from birth to death, but you have a health span, and that's the number of years that you are healthy. And so the purpose of That Salad Lady and her blogging and all the things that she does is about improving that health span and increasing that health span so you have more healthy years than non-healthy years, because being unhealthy can be more expensive than eating healthy. All right.
And one more thing, just to clarify too, I'm looking at the things scroll around. So that .salad.lady is only for Instagram. Everything else is That Salad Lady. So thatsaladlady.com, That Salad Lady on everything else. But yeah, I wanted to clarify that because we want to get you to the right place.
Absolutely. I forgot to put that. I did put that in the comments when I
Shame
posted.
on you, Ella.
When I
Yeah,
posted
yeah,
that.
yeah.
Well, you left us. You know what I'm saying? You
Shame.
left us.
You know better.
It's all good. It's all good.
Thank
All
you.
right. And last but certainly not least, Dr. Yolanda, take us home.
Yeah, so as a pediatrician, I am all about modeling. I want everybody to get all of this information, do it for themselves. And I often find that as a parent, you'll do more for your child than you'll even do for yourself, truth be told. As a parent, as a pediatrician, I get parents that bring their children in and they are making sure that they bring their children in, but I'll ask them the last time that they've had their own well visit, and it's been 5 years, 6 years. And I said, well, okay, so what are you waiting on? The point I'm making is all of this stuff is collective information. I think that is best for the entire family, because what you do for yourself absolutely trickles down to what happens with your children. Mm-hmm. I'm all about heart disease. This is a phenomenal, atrocious statistic, but 49% of African-American women have heart disease by age 20. You guys, this is an epidemic. That means it's pediatric. Why are we dealing with heart disease, and why did I specify it? Because it is so much attached to our diet. It's attached to our lack of activity and exercise, and it's attached to the fact that we do not address stress in our lives. Those are the 3 biggest things that we could do to mitigate heart disease. Heart disease is one of the number 1 killers for us as African Americans. So if we eat right, if we start exercising and listen to these folks that's on here, and if we address our stress, we're not just going to affect ourselves and ourselves as a person, we're going to affect our whole families, our communities. I promise you, the optimist in me is we're going to affect the world. So I need us all to be listening to these very specific things. I'm Dr. Yolanda MD on Instagram, as well as I have dryolandamd.com is my website. And again, I'm here to talk about most of these issues as well, but I'm so grateful for my colleagues today for everything that you guys have expressed.
This has been a wonderful, wonderful, wonderful panel. One of the things that in producing the shows, and Dr. Yolanda is going to be coming on and starting a show here on Black Doctors, so we're excited about that. But one of the things I love about, with T-Fal and Chi is they always talk about EMTS, right? Eat, move, think, sleep, right? Those 4 things can go a long way to improving your overall health and wellness. And so I want to emphasize that as we're closing up today. I want people to recognize that your health is the biggest asset you got. It's not your home. It's not your car. It's not how big your bank account is. Because if you don't have your health, none of those extravagant things that we like to fill our lives with is going to do you any good if you're in a hospital bed or if you're in the grave, or you can't move well enough to enjoy it. So you have to understand, you got to reprioritize things in our lives, right? We have to prioritize those things in our lives. And we got to say to ourselves, what's more important? This little bit of satisfaction we get from that Snicker bar, because I love Snickers. I brought it up twice on the show. So, yeah, and I see it every time. I don't go around when you don't go around the perimeter, you go up the miles, you'll see that Snicker bag, right? They make them bite size, and they make them all kind of ways to get them into your body, because sugar is addictive. And it causes corrosion and all that stuff in your body. So you got to make sure to understand that you protect your number 1 asset, and that is your health. And then your number 2 asset is your family, right? You got to take care of yourself, because you can't pour from an empty cup, and you got to take care of your family. And if you teach them the right way, they will have a better chance to have that healthy health span over their time in their life. So thank you all for joining us today. We'll see. We have one more to go. This is wonderful. We just did a heart disease panel, Dr. Yolanda. I wish you'd have been on it. We just did one right before we came on here. So excited to have you all. I'll see you all soon. Thank you. And we'll see you on the next one. We'll talk about mental health. Mental health.
Thank you so much.
Thank you for having us. Thank you. And thank you, everyone. Good to see you.
Thank you. Bye now.